Peptic ulcers are open sores in the upper part of the digestive tract that can cause belly pain and that can lead to internal bleeding. There are two types of peptic ulcers: gastric ulcers, which form on the lining of the stomach, and duodenal ulcers, which form on the lining of the upper part of the small intestine. Who gets peptic ulcer disease? There are two major causes of peptic ulcers: bacterial infection with H. pylori and NSAIDs. H. pylori infection causes increase in the amount of acid in the stomach and small intestine, and inflammation of the lining of those organs, and a breakdown of the protective mucus layer. On the other hand, NSAIDs, such as aspirin, ibuprofen, and naproxen, cause impaired protection by the mucus layer. Other risk factors include genetics, smoking, cigarettes, and alcohol. What symptoms will we experience with peptic ulcer disease? Some are asymptomatic, some will have upper abdominal pain, heartburn, acid reflux, blood in the stools, which may cause stool to appear black or tar-like, nausea, and vomiting. How do we diagnose peptic ulcer disease? Many of the symptoms of peptic ulcers can also be caused by other conditions, including acid reflux or gallstones. Therefore, additional tests must be performed if we suspect you may have an ulcer. An upper endoscopy is a procedure in which a thin, flexible tube is inserted into the mouth and down the throat. The tube has a light and a tiny camera on the end, which projects images from within the digestive tract onto a monitor. Anyone with a confirmed peptic ulcer should be tested for H. pylori so that infection, if it's present, can be treated. H. pylori can be diagnosed with a biopsy during the upper endoscopy, a breath test, or a stool test. How do we treat peptic ulcer disease? The exact course of treatment for peptic ulcers depends on the underlying cause. Most ulcers can be healed with medications. H. pylori is treated with several medications, usually including 2 antibiotics to kill the bacteria, and an acid-suppressing medication called a proton pump inhibitor, or PPI. Treatment for H. pylori usually takes about 2 weeks. Treatment of ulcers not due to H. pylori includes stopping NSAIDs, quitting smoking, and limiting your alcohol, in addition to a proton pump inhibitor. You should take your ulcer medication as directed, even if your ulcer doesn't cause bothersome symptoms. Some people can stop the medication after 4 to 6 weeks, but others may need to continue taking it for longer if the ulcers are larger or risk of recurring, or if they have had complications due to the ulcers in the past. Certain complications require more invasive treatments. Heavy or rapid bleeding may require IV fluids and blood transfusions in the hospital. Ulcers that are actively bleeding or at risk of bleeding again can be treated during the upper endoscopy. Perforation is when an ulcer causes a hole through the wall of the stomach or duodenum. A perforated stomach or duodenal ulcer is a medical emergency and needs treatment as quickly as possible. Treatment usually involves a surgical procedure to close the perforation.